Hey everyone, welcome to Med-Surg Mentor. Today let's review the topic cardiogenic shock. So let's begin. First of all, let's see the definition of cardiogenic shock. It is a life-threatening condition in which heart suddenly cannot pump enough blood to meet the perfusion needs of the body. Let's move on to etiology of cardiogenic shock. Mainly, cardiogenic shock occurs due to two reasons. They are systolic dysfunction or contraction issues and diastolic dysfunction or filling issues. Systolic dysfunction means heart cannot pump blood out of the heart, whereas diastolic dysfunction occurs when the heart chambers do not fill properly, resulting in poor organ perfusion. Common conditions leading to cardiogenic shock are arrhythmias, myocarditis, pulmonary embolism, endocarditis, cardiomyopathy, heart attack, pericardial tamponade, myocardial contusion, heart valve problems, ventricular septal defect, and ventricular outflow obstruction. Risk factors of cardiogenic shock are female gender, history of diabetes mellitus, hypertension, heart attack or heart failure, older age, and blockage on main coronary arteries. Pathological changes in cardiogenic shock. Due to etiological factors, the left ventricular filling pressure is increased. It results in pump failure and reduced cardiac output. As a result of this, the organ perfusion is diminished, leading to organ damage at the final stage. At the same time, due to the reduced oxygen supply, there is an increased sympathetic tone due to the activation of compensatory mechanism. This attempt increases the heart rate in order to maintain cardiac output. But gradually, these compensatory mechanisms fail, leading to left ventricular failure and death. Common clinical features of cardiogenic shock are rapid breathing, severe shortness of breath, tachycardia, weak pulse, altered mental status, anxiety, hypotension, sweating, pale skin, cold hands and feet, oliguria, and distended neck veins. Common diagnostic measures of cardiogenic shock are electrocardiography, echocardiography, chest X-ray, cardiac catheterization using Swan-Ganz catheter, blood test, and biopsy. Common complications of cardiogenic shock are cardiopulmonary arrest, multisystem organ failure, ventricular aneurysms, thromboembolic problems, stroke, death, arrhythmias, and renal failure. Now let's move on to the management of cardiogenic shock. Common pharmacological managements are inotropes like dobutamine, antiarrhythmics such as adenosine, IV fluids and plasma infusion, vasopressors like epinephrine, aspirin, antiplatelet medicines such as clopidogrel, and anticoagulants such as heparin. Common surgical managements of cardiogenic shock are angioplasty and stenting, intra-aortic balloon pump, extracorporeal membrane oxygenation, ventricular assist devices, coronary artery bypass graft surgery, heart transplantation, and artificial heart. Lifestyle modifications for the prevention of cardiogenic shock are: avoid smoking, use less salt and sugar, maintain healthy body weight, limit saturated fat and alcohol, and exercise regularly. Nursing diagnoses for cardiogenic shock are: impaired gas exchange related to altered ventilation perfusion, decreased cardiac output related to cardiac muscle disease, ineffective tissue perfusion related to the reduction in coronary blood flow, excess fluid volume related to decreased renal perfusion, impaired breathing pattern related to ventilation perfusion mismatch, and anxiety related to the ongoing disease process. Common nursing cares in cardiogenic shock are: assess heart rate and blood pressure, monitor oxygen saturation and arterial blood gas values, place client in semi-follows position, administer oxygen as needed, assess fluid balance, weight gain, and electrolyte levels, instruct the client to have a low sodium diet, administer drugs to improve cardiac function, and provide electrolyte replacement. With this, we are finishing the brief review about cardiogenic shock. We have seen that it is a life-threatening condition in which the heart cannot pump blood to meet the perfusion needs of the body. It can be due to systolic or diastolic dysfunction. We also discussed the pathophysiological changes, clinical features, diagnostic measures, management, and nursing care. Thank you so much for watching, and if you find this video helpful, please like, share, and subscribe.